Good morning, everybody. I have been given the task to give the introduction speech for this conference.
We'll start with the WHO fact sheet, which says that infertility is a disease of the male or female reproductive system, which is defined by the failure to achieve a pregnancy after 12 months or more of regular, unprotected sexual intercourse. As we all know, infertility affects millions of people of reproductive age worldwide and has an impact on their families and communities. Estimates suggest that between 48 million couples and 186 million individuals live with infertility globally. Next slide. Yeah, I did. Okay. Sorry. So what can cause fertility problems? In the male reproductive system, infertility is most commonly caused by problems in the ejection of semen, absence or low levels of semen, or abnormal shape, morphology, and movement, that is motility of the sperm. In the female reproductive system, infertility may be caused by a range of abnormalities of the ovaries, of the uterus, of the fallopian tubes, and endocrine system, amongst others. The types of infertility and fertility care. As we all know, infertility can be primary or secondary. Primary infertility is when a pregnancy has never been achieved by a person. And secondary infertility is when at least one pregnancy has been achieved. Now, fertility care encompasses the prevention, diagnosis, and treatment of infertility. Equal and equitable access to fertility care remains a challenge. Why addressing infertility is so important? Both men and women can experience infertility. Infertility has a significant negative social impact on the lives of infertile couples, and particularly women who frequently experience social stigma, emotional stress, depression, anxiety, low self-esteem, even violence or divorce. We recognize that provision of high-quality services for fertility care is one of the core elements of the healthcare system. Addressing challenges, availability, access, and quality of interventions to address fertility care remains a challenge. Training of doctors, nurses, and paramedical staff in the investigations and treatment of the couples, obtaining and introducing necessary equipment and infrastructure, that is the intrauterine insemination, IUI lab, laparoscopy, hysteroscopy, medicines, and its uses is our goal. While assisted reproductive technologies, that is ART, have been available for more than 3 decades, with more than 5 million children born worldwide from ART interventions, such as IVF, these technologies are still largely unavailable, inaccessible, and most important, unaffordable for most of us. This national conference is aimed at medical and paramedical staff from the fields of obstetrics and gynecology, urology, dermatology, endocrinology, and all other faculties, even in the private sector, who encounter patients with fertility problems. We have senior consultants, senior specialists, and specialists from Salalah, and eminent faculties from Muscat and other GCC countries like Abu Dhabi and Qatar, who will guide us through the latest updates in this field. Topics like evaluation of the infertile couple, systematic approach in management, surgical interventions to optimize outcome in female fertility, recurrent pregnancy loss, all about the IUI, that is the intrauterine insemination, techniques of semen wash, male infertility will be discussed on the first day today. On the next day, that is tomorrow, we have very eminent and experienced senior consultants from Muscat and also consultants, like I said, from Abu Dhabi and Qatar to address difficult and challenging topics like overview on fertility management and changes in Oman, current trend in the management of pelvic endometriosis, endometrioma and fertility, which is a devastating condition affecting fertility, ovulation induction protocols, male infertility, and most important, the IVF journey. Today, we all have been able to assemble here as a result of the vision and hard efforts of many people. To name a few, our DG Director General, Dr. Sami Farah Al-Rawaz, our Assistant Director, Dr. Ahmed Khatun, our HOD, Dr. Nisha Sharma, our Deputy HOD, Dr. Asma Gheli, our Senior Consultant who is so active in infertility, Dr. Archana Mohan, and many others. We applaud the hard efforts of all our speakers who are going to bring excellent updates and information of all our organizers. But this would not be complete if I didn't mention the silent warriors who are playing in the backfield. These are our doctors and nurses who are all over. They are in the OPD, they are in the labor room, they are in the operation theaters, in the wards, who are working silently to allow these organizers and speakers to achieve this conference. I wish you all a very good day.